Hi everyone, this is Dr. Devin Barley with Greenwich Chiropractic, and in this video series we're talking a lot about whiplash type injuries. And we know that 90% of whiplash cases are going to be because of a car accident. While there are a small percentage of cases where it could be something like a sports injury, a slip or a fall, 90% is going to be from that acceleration, deceleration force. And what that does is it places a lot of pressure, stress, tension on the ligaments, tendons, and muscles that surround things like your spine. So the first test to be able to understand whether or not you might have whiplash, and of course the best determiner of this would be a healthcare professional, is just checking range of motion. So the muscles, tendons, and ligaments are responsible for the amount of motion that you have in your spine. So very simple tests are to go through the ranges of motion in the neck, which is flexion, tucking your chin all the way down to your chest, extension, tilting your head all the way back, left lateral flexion, bending all the way over to the side, right lateral flexion, bending it all the way to the other side, rotation, bending it all the way to the left and all the way to the right. Now, when you're going through that range of motion, if two things: one, the range of motion is reduced less than you normally have, or two, going through those ranges of motion, especially at the end of the range, is really tender or causes stiffness, you most likely have whiplash, okay? That is the baseline test. The second thing that you can do to determine if you have whiplash is a little distraction maneuver. So what we know is that when those ligaments, tendons, muscles get injured, they're going to splint, they're going to contract, they're going to spasm. That's what reduces that range of motion and can contribute to pain. So what you want to do is you want to grab sort of the back of your head and give a little pull up. And by pulling up, you're going to create more tension on those ligaments, tendons, and muscles. And if it increases pain, that most likely means that they've been injured as the result of whiplash. Most people who don't have whiplash, if they lift up on their head, that will actually feel like a good stretch. In this scenario with whiplash, it will feel like a bad stretch, so the complete opposite. And if you're experiencing some of these symptoms with a couple of these tests, then you know that you have some whiplash injury. And if you haven't been seen, it's always a good idea with an injury like that to get seen, to make sure that there isn't something else going on underlying, something like a disc herniation or a pinched nerve or a ligamentous injury or a fracture or a dislocation. So if some of these tests were positive for you and you've had a whiplash type injury, then please get seen by a healthcare professional. Thank you so much for listening. We'll see you on the next video.